The very first promise I made on this campaign was that as president, I will sign a universal health care plan into law by the end of my first term in office.
Barrett pays $54 a month. The new plan she's being offered would run $591 a month, 10 times more than what she currently pays.
And will also include high standards for quality and efficiency.
And signed by a president who smokes.
We will reduce waste and inefficiency by moving from a 20th century healthcare industry based on pen and paper to a 21st century industry based on the latest information technology.
Well, we tried it last week, Wolf, and we couldn't do it, and then we tried it this week and we couldn't do it. We did it through the federal site because we live in Georgia, and like most states, they're using the federal site. So you get this page, and then you get let's get started, so that was good. And then you have a page where you create your identity, and that worked, so that was good. And then we got to the page where you answer security questions. These are all things you need to do to create an account. Last week, we got stuck on this page. We couldn't make this page work. This week, this is good, a good sign. We managed to make that work. So we got to a page that then said, please wait. And then, this is where it didn't go so well. It says, your account couldn't be created at this time. The system is unavailable. So still, we've been trying and trying and trying since Tuesday of last week, still unable to create an account.
Well, the system's broken, and I think that people all across the country recognize that.
There is nothing in the Affordable Care Act that said that your insurance company should cancel you.
In California, Kaiser Permanente terminated policies for 160,000 people.
She would force, in some fashion, individuals to purchase health care. People are being fined for not having purchased health care, but choose to accept the fine because they still can't afford it, even with the subsidies.
A 62-year-old in Charlotte looking for the same basic plan would get a price estimate on the government website of $394. The actual price is $634.
The insurance companies actually are happy to have a mandate. The insurance companies don't mind making sure that everybody has to purchase their product.
Obamacare, the health care plan that we are forced to purchase and fined if we don't.
We are forcing them to purchase insurance, and if the subsidies are inadequate, the burden is on them and they will be penalized. And that is what Senator Clinton's plan does.
As one big group, these customers will have greater leverage to bargain with the insurance companies for better prices and quality coverage. This is how large companies and government employees get affordable insurance. It's how everyone in this Congress gets affordable insurance, and it's time to give every American the same opportunity that we give ourselves.
Their introduction to the Affordable Care Act has been negative. A broken website and now cancellation notices from insurance companies, followed by sticker shock over higher prices for the new plan.
It's very easy to disguise a medical program as a humanitarian project. Now the advocates of this bill, when you try to oppose it, challenge you on an emotional basis. They say, what would you do? Throw these poor old people out to die with no medical attention? That's ridiculous, and of course no one is advocating.
If you like your insurance plan, you will keep it. No one will be able to take that away.
But people across the country are finding out they're losing their existing insurance plans under Obamacare. That's because requirements in the law, like prenatal and prescription drug coverage, mean their old plans aren't comprehensive enough.
The majority of people in this country, the vast majority of people in this country, are keeping their plan.
But we have to pass the bill so that you can find out what is in it. Dun, dun, dun.